Nicer weather means more time outdoors and also means we do need to be careful about how much sun we're exposed to. And to help us understand why that is and how we can keep our skin healthy, we're going to speak with Dr. David Jones, who is Chief of Dermatology at Newton-Wellesley Hospital. Dr. Jones, thank you so much for coming on. I appreciate this.
You're very welcome.
Let's get started with the big general question, which is, why is sun bad for your skin? What does the sun do to your skin when you get too much?
Well, sun causes damage to the skin. There is no getting around that.
Right.
And the more sun you get, the more damage you get. In the short run, everybody's familiar with the fact that sun causes sunburning. So you get a painful sunburn in the short run, and in the long run, causes skin cancers. It causes precancers, it causes early aging type damage as well. And so we are definitely trying to get people to be very careful to protect their skin from the sun.
Skin cancer is a very scary thing, and I wonder if you could explain a little bit about the different types of skin cancer and which ones are most affected by excess sun.
I certainly can. So all of the common types of skin cancer are caused by sun. The most common two types of skin cancer are basal cell cancer and squamous cell cancer, and they're really purely caused by sun. Melanoma is the third common type of skin cancer, which is considerably more worrisome. And melanoma also can have a bit of a genetic influence. That the propensity to melanoma is something that can run in families, as well as being caused by sun. So those are the three types that we try and educate people about, being the most common types. Basal cell cancer is the most common type, and that tends to be the least worrisome.
Yep.
It's one that doesn't tend to spread through the body. It really does not kill people. These cancers need to be treated. They need to be removed from the surface of the skin, but those can generally be done with relatively straightforward office procedures. Squamous cell cancer is similar, although it can grow a little bit more quickly, and in some cases that is something that can spread. Squamous cell cancers definitely need to be taken seriously. They definitely need to be treated, but in the vast majority of cases, those are also relatively straightforward to treat. Melanoma can be a much more worrisome type of skin cancer. The vast majority of melanomas we do find early. We find when they're in the very earliest stages, and those are readily cured with office-based surgery procedures. However, melanoma is one that can spread. That's one that can metastasize. It can spread from the skin to other locations in the body and can ultimately prove fatal. So we definitely like to find melanomas early and get rid of them. And even better, we like to prevent them through sun protection.
We're speaking with Dr. David Jones, who is Chief of Dermatology at Newton-Wellesley Hospital. I wonder if we could go a little bit deeper on the detection part of this. You mentioned early detection is a way to keep the cancers from becoming more worrisome cancers. Talk a little bit about, what we should be looking for. How often should we check?
Well, so how often to check varies by person. So people do vary in how prone their skin is going to be for skin cancer. And people vary widely in how much sun damage they've accumulated over their lives. So there's no sort of simple rule about how often somebody needs to be checked by a dermatologist or if they need to be checked at all. It's always reasonable to get at least a baseline examination by a dermatologist.
Yep.
They can look over your skin. They can make a careful assessment as to what sort of risk they think you are for skin cancer, and then they'll come up with a recommendation for how often you should be checked. And once a year would be probably the most common scenario, although some people at higher risk need to be checked twice a year or even sometimes more frequently.
How does age factor into this, Dr. Jones?
Well, that's an interesting question. The most common types of skin cancer, basal and squamous cell cancer, do tend to get more common as people get older. They're caused by sort of a lifetime accumulation of sun damage, and so the older people get, the more of these tumors they tend to get. However, it's not at all rare to see somebody in their 20s and 30s with some of these skin cancers. Melanoma is actually a little bit different. Melanoma, the age incidence curve of that is a bit more flat, meaning that we see plenty of folks in their 20s and 30s getting melanoma. We see plenty of folks in their 40s and 50s, 60s and 70s, and the number of people getting those cancers tends to be relatively constant. So melanoma, unfortunately, is something that younger people are nearly as prone to as older people.
Interesting. Dr. David Jones is Chief of Dermatology at Newton-Wellesley Hospital. We're talking about fun in the sun and keeping your skin healthy. You mentioned prevention, keeping from getting to the point where you need to worry about that. Obviously, the big thing is the big tool is sunscreen. And so I want to ask you smart ways of using sunscreen. How much of it do we need? Do we slather ourselves with it? Do we take a bath in sunscreen? What are your thoughts on that?
Oh, well, I'll definitely tell you about that. But sunscreen is actually just one part of what we recommend for sun protection. Shade also works very well.
Right. Yeah.
From sun damage, sun protective clothing is extremely helpful. I try and encourage people to do a lot of their outdoor activities a little earlier in the morning, a little later in the afternoon, trying to avoid some of the midday sun.
Right.
So those are all straightforward things that are extremely important for sun protection. Now, that said, sunscreen is an incredibly valuable tool, and I absolutely do recommend sunscreen. When you're looking for sunscreens, you want to try and get a sunscreen that's got an SPF rating of 30 or greater, and you want something that's going to be labeled as either broad spectrum, or the older labeling is something that blocks UVA and UVB.
Yeah.
And the majority of the sunscreens out there these days do. It's actually not hard to find a good sunscreen. The thing that's sometimes tougher is to find a sunscreen that people like and will use. That's actually where I think people have to put some effort into trying a few different sunscreens, trying a few different formulations and vehicles to find something that people actually like and will use. The amount that you need is more than you might think. So if you want to cover all of typical sun-exposed surfaces, you need about the amount of sunscreen that could fill a shot glass. And if you're going to be out, for a long day, you're going to have to be reapplying this in a few hours as well.
Got more to talk about. This is Greater Boston Today. I'm George Knight. We'll have more with Dr. David Jones, Chief of Dermatology at Newton-Wellesley Hospital, right after this. Greater Boston Today continues. We're speaking with Dr. David Jones, who is Chief of Dermatology at Newton-Wellesley Hospital, talking about care for your skin, having fun in the sun, and still staying skin healthy. Have people gotten smarter about this? As we're talking, I'm realizing when I was a kid, so there was sunscreen, but, sometimes people would go out to tan, and not only would they not use sunscreen, but they would put oil on their skin. Were we just being big-time dummies back then, or do we know more now?
Well, we know more now than we did back then. It's absolutely true that older folks back in the day, people were telling them it's good for you. Go out in the sun, get a good sunburn.
Vitamin D, yeah.
You won't have as much. And then you won't. Well, that's a more modern problem.
Yeah.
But back in the older days, there was a lot of misconceptions. The sun was good for you, and people weren't tuned into the skin cancer as much as they are now. The vitamin D thing is a more modern thing. So more modern research was suggesting that we need sun to get a lot of vitamin D, and that vitamin D deficiency is a big problem. The vitamin D deficiency is I think a little bit overblown. I think unfortunately too many people are using that as a justification to get too much sun.
Right.
My recommendation is to either talk to your primary care physician and consider getting your vitamin D level tested, or to just go ahead and take the vitamin D supplements. They're you can buy them over the counter as vitamins, and that's a very effective way to get all the vitamin D that you need. There's really no need to get vitamin D from the sun. There are other ways to get vitamin D. Again, there's testing available to see who's really at high risk of bone problems with this. And so those are my recommendations for getting vitamin D, rather than, trying to get a certain amount of sun.
Straight from the sun, yeah. Dr. David Jones is Chief of Dermatology at Newton-Wellesley Hospital. Apart from the obvious sun-heavy places like the beach, where else do we need to be extra careful about getting too much sun? I'm always astounded. It doesn't have to be warm climes where you can get sunburns. People get sunburns on ski slopes, for instance.
Well, you can. So certainly water and snow are very good at reflecting sunlight.
Right.
So you get sunlight coming down and you get sunlight coming up. So something like just a hat may not give you all the shade that you need. You need a hat plus sunscreen. And you have to be very careful that, if you think you're in the shade at the beach, you're still getting a lot of reflected sunlight from the water. So certainly reflected sunlight is something to keep in mind. The amount of time that you're out in the sun is something to keep in mind.
Yep.
So we see a lot of problems in golfers. If you're out there for 5 hours on a day playing golf, that's a lot of sun.
Yeah.
Sailors, I see a lot of sailors. They tend to take sort of long sailboat rides, getting a ton of sun. People who work outdoors, people who work at outdoor jobs, can have a long day out in the sun. And some of the activities, like people go into a beach. A day at the beach. People tend to make a day at the beach out of it. They don't make a 15-minute walk along the beach.
Right, not a quick hit.
So definitely I think focus on the amount of time that you're out as well as the activity.
And remember that shade can be your friend.
Absolutely.
Dr. David Jones is Chief of Dermatology at Newton-Wellesley Hospital. Before we wrap up, we had talked before you came on about a website that you were saying has some cool stuff on it, some great information, a good resource. And if you would give that website, please, that would be great.
Absolutely. So the American Academy of Dermatology is our dermatology medical society, and there is a website at aad.org that has a lot of excellent patient information. There's links to other information. There are PDF pamphlets you can download, and we've got some dedicated material about sun protection and skin cancer risk. There's also patient information on a wide variety of other skin conditions. So aad.org would be my recommendation.
Very easily found online. I'll give it again, aad.org, and find out more, get some information on keeping your skin healthy. Dr. David Jones, Chief of Dermatology at Newton-Wellesley Hospital, thank you for coming on and helping us find some ways to have fun, stay outdoors, and at the same time keep our skin in nice, healthy shape. Thanks for your time. I do appreciate it.
You are very welcome. Thanks for getting the word out there.